Hi, welcome to another episode of Hatching for Health with your host, Jessica Hatch. We are here to create awareness for children with rare conditions with hopes of finding cures. Today's lovely guest, we have Miss Angela Schultz, we have Nurse Bassett, and we have with us Dr. Ron. And your last name, Dr. Ron?
Swadzina.
Beautiful name.
Thank you.
Sounds much better when you say it. I'm so glad you guys could all be here. We also have Jacob with us, your son. He's 13, and he's the reason we're here today. So we're going to learn about his condition. I would like to have him come on in the second half of the episode, just so we can all, visit with him a little bit as well. But I wanted to start with just kind of introducing you guys as it relates to your, specialties. So I know you're with Houston Neuroscience Brain Center.
Correct.
Okay. And you're with the Center for Health and Healing.
Yes.
Okay. And you're the mother that found them for your son.
Yes.
So, Dr. Ron, is this something that you focus predominantly, I'm assuming, on the brain?
Well, our focus at the Neuroscience Brain Center is always to identify what's causing a person's symptoms.
Okay.
And I have two neurologists that work every case with me, and we're looking for the underlying EEG abnormalities that may be pointed in that direction.
Okay. And from the nurse, did you guys actually meet her originally with your son that kind of led to them?
Actually, no. So my relationship and Jacob's relationship was with Dr. Ron first, initially. So we have been seeing Dr. Ron since Jacob was about 6 years old, and working with him with brain mapping, QEEGs, and neurofeedback brain training. Also with kind of guiding medication choices based on brainwave activity as opposed to based on symptoms of behavior.
Okay.
And then this last go around when Jacob went in for a brain map, there were some differences based on what Dr. Ron had seen previously. And so then Dr. Ron referred us to Nurse Practitioner Bassett.
Okay, so that's kind of how, and just so I can kind of, lay the ground. So Jacob was diagnosed with leaky gut, imbalanced gut bacteria, and toxin overload. Is that right?
That's exactly right.
And
yeah.
so there's basically, 3 different conditions here, not just one. And were they all diagnoses like that happened at once, or was it a combination of time?
Yeah, so my goal is to really look for what's driving the symptoms, so root causes. And so I really take a comprehensive approach, and we want to hear everything that's going on and put all these symptoms together. And based off of the story that Jacob shared, and I looked at toxins like heavy metals and molds and gut health, and genetic variations that can cause issues. So he had a lot going on.
Yes.
Wow. So from that point, like the things that you were noticing in him, how did it kind of tie into the brain?
Right. So how it all came about was Jacob was having some behavioral issues, kind of more than normal. We changed schools. He now goes to Foundations Christian Academy.
Okay, yeah, that's how we got connected.
Right, with Monica Howard. And Jacob had struggles, transitioning into the new setting and in the new school, but he had leveled out a little bit. And then suddenly Monica calls me one day during summer session, and she said, something's different. There's a wild look in his eye. I'm struggling to redirect him in his behavior. It's just something's changed. And, kind of my first thought was, well, he has a med doctor appointment, in a few weeks.
Yeah.
We'll go to the med doctor. And then something said, no, you need to call Dr. Ron. So I called Dr. Ron, and we scheduled the brain map. And so that's how it led to this. He recognized the abnormalities. We come in to see Nurse Bassett. Nurse Bassett sends us for, we took, blood samples and all kinds of lab samples, lots and lots of lab samples. But the information that came from that, it's life-saving. It's indispensable. We've been on a protocol to first heal the leaky gut. From that we started seeing improvement in clarity and a little bit of subdued behavior. He kind of got back to where he was more easily redirected again. but we've even seen more since then. You know, as we've gone through the process, I think we're working now with detoxing the molds from his system.
So, okay, so these molds, is this something, I mean, typically when someone has any kind of, you know, mold found, that's usually from their environment. Is that right? Or is this something that had actually...
Yeah, you can have it from food as well, but
Okay.
most of the time it's from the environment. And we see a lot of brain symptoms when there's toxins in the body. So it's something I really am aggressive in looking for.
So this is probably, there's a lot of relationship between like patients that you guys are treating and referring back and forth.
Well, that's the beauty about having somebody like Melissa here to help me out, because when we do the EEG and we can see these abnormal patterns, and it's just something about it that just doesn't look right. And it's hard to describe, but they don't quite meet the criteria for an encephalopathy, but the brain is dynamic, and it slowly starts working its way towards, for instance, in Jacob's case, I had seen him in 2019, so I had a pretty recent pre.
Okay.
And then he came in the summer, August of 2023, and it's like his amplitude of his brain waves, his alpha wave, had been cut in half. And at this age, you would not see a reduction of amplitude, how much microvoltage we could read out of his brain. And his peak frequency of alpha, which we're always looking at, had slowed down. Well, your peak alpha maxes at 14 and doesn't slow till you hit my age at 70. So
Okay,
that
so
shouldn't
it's
be
very
there.
obvious.
That's obvious it was not right. So the neurologist and I, we paired up and said, we've got to have some more. There's something, it looked more toxic. We're seeing a lot of toxic mold in children, especially since Hurricane Harvey hit. And it really affects their brains more so than adults' brains. And so this is something that we see pretty often in my practice. And so I kind of knew what we were looking for. And but I have to have the functional medicine group to sponge this out. I
Kinda
can't
help
order
expose
labs.
that, yeah.
I can't order labs. They can order labs.
And
She
get-
does the in-depth. So it's a great teamwork.
No, it makes a lot of sense. And your background, I know, I mean, you're a huge advocate, obviously, for your child's condition, but you're the CEO of Papillon Integrated Recovery Center. So tell me about that.
Yeah, so it's behavioral health.
Okay.
We work with folks who are recovering from substance abuse. We provide safe housing. We provide outpatient behavioral health care and
Okay.
reintegrate people back into society. So
Okay.
it's a different faction, but you know, the behavioral health aspect of it, I seem to be immersed in it with with my
One way or another.
right, my passion, my son. You know, ABA therapy, applied behavioral analysis therapy, and all
Yeah,
kinds
that's a
of
lot
stuff.
of what I know the school offers that
Exactly.
we got introduced from. And so,
Yeah.
so he has kind of those learning differences, and which is, you know, why he's there. But all
Right.
of this other stuff is completely unrelated. Like this is, you know.
It is. It is or it isn't. I mean, I
You're
think
wondering
that
maybe if
I think
it's been
that
going on
remains to
longer.
be seen, right? Because one of the things that nurse practitioner Bassett pointed out in the findings of the lab results is that Jacob actually does have a gene variation that indicates he cannot naturally detox his own body in the way we normally would.
Really?
So when these things enter his system, you know, even if they're in non-toxic levels you know, in the environment, he can potentially get a buildup of them because he can't naturally detox his body sufficiently.
Okay.
So, you know, this could be something that's been going on a long time
and triggering the neurological system
it-
to actually.
Right.
you
Now
know.
there's certainly underlying, you know, long-term symptoms there that will be there forever. But you know, to the greatest extent that we can clear out any other barriers in the way,
Yeah, of course.
is a huge thing. And the benefits that we're seeing, like I said, just so far, we've seen, you know, clarity. We've seen his behavior, you know, be redirectable, and his obstinance be reduced a bit. And honestly, I think that is related to him having better processing when he's receiving something, you know, auditory, receiving. He understands it better. And so his first initial response is not just no, you know, just leave me alone.
Yeah.
It's like, okay.
Yeah.
And suddenly
Like
we
he's
have this
listening and,
yes,
you know,
and
computing it.
process
Yeah.
exactly, and processing it, and really being able to think it through and have an organic response to it. So that's been huge. His handwriting has suddenly like gotten better. I mean, his communication verbally
And
has
how
gotten
long
better.
ago was these diagnoses made, like with the leaky gut?
I think September, October.
Yeah,
Early September
It's
was when we
not
got
been
referred.
long. Well, yes, probably. So we did
few months.
just
Wow.
a few months, and
So is this like what you're seeing with Jacob? Are these common things that you're diagnosing in children around his age? Is this, you know, it's not completely like out of, you know, nowhere?
Right.
Okay.
Yeah, these are things that we love to help children with, and it's exciting to be part of this healing
bet it
and
is when
understanding what's
you-
really driving these problems.
So tell me, what does that treatment look like? Because I mean, if he's already having improvements, just there's obviously been treatment that y'all have been undergoing for these short few months.
So we're maybe halfway through his treatment, maybe less. Like
Okay.
we're just getting started.
And is there, the testing is done over here and then the actual treatment is coming back your way? Because there's only the testing done.
Right.
Or do y'all actually continually do?
Well, if we're going to work with the brain,
Mm-hmm.
we've got to address the toxins and the inflammation, because the brain becomes inflamed. That has got to be the first step. We don't want to try to rewire the brain until we start getting the toxins out, because you're still feeding the fire, and we don't want
Yeah.
to do that. And just one comment I want to make to everybody out there: the best diagnostic tool we have in this industry is a mother's gut.
Yeah.
When she tells us there's something we're missing, there's something not right here, as you picked up on, that's when we really need to take a deeper look and see, because most times this would often be just referred on to psychiatry and medicated and put in ABA
Yeah.
again, and this is not the way we do it. So we got to listen to these mothers. It's very valuable what they give us, and they know their kids. They know when something's not right. I'm just glad I had the relationship with Angela, and I've known him since he was 6 years old. Now he's 13. That made the difference.
Of course.
You know, so it was like, that's when we need to really look deeper. And now we've got a really beautiful system working together. So
I know, it's like something, and that's obviously why y'all are here today too, to, you know, shed light on these particular diagnoses so that others can get connected. There's, you know, now you guys are a little power team on what's being done here. We do have to take a commercial break, but we'll go into the treatment when we get back, and we'll get to meet Jacob. So we'll be right back with you after this quick commercial break. Hey, welcome to Infinity Diagnostic Center and Prestige Medical Pain Clinic. We are right here in the heart of Houston, inside the 610 Loop. We do interventional pain management and we do MRIs. Our MRI facility offers a 1.5 Tesla Siemens magnet. We can do MRIs of the brain, spine, any extremity, foot and ankle. We got you covered. Then we have our pain suite. So our pain suite is for when you do have that pain. You get the MRI, and now the doctor can sit and evaluate that MRI with you and look at exactly what's going on. And right here, they'll do an interventional pain injection, ESIs, transforaminal, a various amount. We've got 2 doctors on staff, so we got you covered. Before you actually get set up over here, you're gonna come to our consultation room, in which you will be visited with one of the specialists. And we're treating insurance, cash patients, Department of Labor, and personal injury, which is so important. So we can take care of all of those different needs. Just come see us here at Infinity Diagnostics and Prestige Medical Pain Clinic. Welcome back from the commercial break. If you have just joined us, we are here with a lovely family, Miss Angela and her son Jacob, along with a doctor and a nurse that have been treating Jacob with a condition known as leaky gut, another imbalanced gut bacteria, and toxin overload. So we are finally have Jacob on with us. How are you?
Good.
Thanks for coming. Did you leave school today early?
Yeah.
Oh no. Well, I appreciate it. I'll tell Monica thank you. I know you're administrator over there. Do you like that school?
Yeah.
It's a lot of fun there. I really I've visited a few different times and brought lunch and got to meet, you know, a few of the other students. So
Miss Monica really did play an integral part in this, in, you know, having a school setting where, you know, a school that's individualized enough that, you know, they know their kids well enough to be able to point out that there was a struggle, that there was something that had changed. And it really was her, you know, the Foundation's Christian Academy that identified and brought it to my attention you know, that we need to.
Yeah, which just shows like how focused they are in this, like they have small setting of children.
Exactly.
In the classrooms, which I think they just get more of that one-on-one attention of the child. How long have you been attending, Jacob? Have you been there about a year?
Yeah.
Okay. Do you like it?
Yeah.
That's good. So with all this stuff going on and seeing the doctors, have you been feeling lately? Have you been feeling better? Mm-hmm. Yeah? Kind of a different sense of clarity?
Yes.
Yeah.
When I saw him today, I was so impressed. He looked taller, and he's lost weight, and his eyes were bright. It was just a fun change because I haven't seen him in a few months. So
like you can definitely like recognize it, you know, seeing him, you know, at several different appointments and stuff. I bet. Yeah, you look great to me. So that's what matters. You're standing tall. So with the family, like what's the dynamic like? Do y'all have other children in the family?
I do, yep. We have my daughter Matea, Jacob's sister, and she's 10.
Okay.
And she is fabulous. She's a piano player. She does jujitsu. She's
Wonderful.
Yeah, she does great in school.
So what has the dynamic been with, you know, kind of this diagnosis and things going on? I mean, has that like affected?
I mean, I think the dynamic, regardless, is a struggle sometimes. I mean, you have
I want to
kids.
use it.
You have kids that siblings that already have natural sibling rivalries and comparisons and all of that. And when you're, you know, not necessarily comparing apples to apples, it makes it a little more difficult to be fair about things. So, but I think that there's a recognition that, you know, from her part, that there's improvement, and you know, that ability to communicate better. That's really where we're seeing a huge uptick in Jacob's abilities is communications.
Well, that was one of the things. So with school and like social interactions, Jacob, do you play any sports? What are your hobbies?
Well, only I play basketball.
You do? That's great. So have you been playing recently since you've kind of had some treatment?
Yes.
Are you good? You do score a lot?
Yeah.
I bet you do. A little confident. He's like, give me the ball. So as far as like he's been able to continue to attend school during all of this, any kind of recreational things, that hasn't, you know, had to stop.
It hasn't. There's, again, as far as the treatment goes, there's really not been any adverse side effects. Everything has been a positive.
Okay.
You know, the weight loss, sleeping better, you know, better digestive movement, all of those things are improving, which has just, you know, improved his overall health, more energy. He works out with me.
That's great. Yeah.
You know, he wants to.
Yeah.
So.
And are you guys? Do y'all live like closer to Webster, or where are y'all located?
We're in Seabrook.
Okay. And then where are y'all's offices at?
We're downtown, just north of the on Kirby Drive, just north of 59.
Okay.
and I'm right by Memorial Park.
Okay. Very good. So you guys have been traveling in to meet with them. Okay. So I wanted to go to you, Dr. Dan. So this EEG / QEEG treatment, is that how it's
Yeah,
said?
it's a electroencephalogram and then a QEEG brain mapping. We do both.
Okay. And so he comes in, kind of walk me through it. Is it like a little like helmet that's put on, or is it?
Well, we use an electrocap, and it's rather than use the different 19 leads like neurology use, we use a cap, gel the cap up to make the connection with his brain. It takes about an hour. We're doing about 12 minutes with his eyes open, 12 minutes with his eyes closed. Jacob's great at doing it. He's done it many times with me in the past, so he knew what to expect. But we do have a video on our website so that people can see what the procedure's like. And I do a lot of children with autism, so they can be quite challenging at times, but I've been doing this since 2005, so it's not a big deal anymore.
Yeah, and this is just giving, you know, the parents an opportunity to kind of see the changes in their, you know, son or daughter's basically brain, and like, you know, whatever they've been doing to work on improving those skills, they can come back in and maybe see like, oh, okay, this is actually helping. Or
Right.
I mean, usually you can see that in the child, but I'm sure it makes a big difference to actually kind of lock in what's going on internally.
Seeing something that's totally scientific, that
Yeah.
there is change. I love to see electrical change in the brain, but the most important thing is his life improving? That's our job.
Yeah,
And
of
sometimes we can
course.
see very little change in the electrical and big changes in the person, and sometimes just the opposite. So, but it's a process that I think we need to make that shift to where we're actually going to look at the organ we're treating and stop just basing everything on symptoms.
Mm-hmm. Yeah. So Jacob, do you like going and getting this done?
Yeah.
Yeah? It's easy, no pain. Just go in there and let them check out your brain, huh?
Mm-hmm.
That's good. So for any other kids watching, they know that not to be scared. You know?
Yeah.
And Melissa, do these tests then get sent to your clinic? And kind of, I guess
Yes.
you guys are,
Yeah, we collaborate and visit on the phone and
Do Zoom sessions together?
really work
All of
together
it.
to help the children.
yeah. No, that's fantastic. Okay, so we were also going into the treatment actually before the commercial break. So tell us a little bit about like what Jacob is undergoing to get from, where he was a few months ago.
Yeah, so just to be clear, so what we found he has some heavy metals. He has mycotoxins, which is a toxin from mold. He has a gene variation called MTHFR, which is pretty common.
Oh, yeah,
But
I've
he
heard
has
about that.
two of these different parts to it. So we found all that, and then his
I'll be
gut
darned.
has an overgrowth of good bacteria called
Okay.
SIBO. That's one of
Okay.
the big things there with his gut.
Okay.
And so we're in the process of repairing his gut, and we just use different botanicals and probiotics and binders, things like that, that can help to kind of clean out the gut.
Yeah.
And then we are just starting the mycotoxin protocol. We started that. So to get rid of mycotoxins or molds, first we want to make sure that it's out of the environment. So we have families check their homes. And
That's what I was going to say. So did you guys kind of identify like if it was in, like the home or like school or, where?
So 2 of his molds were food related, and then the other 2 were environmental related. And we had our air quality tested, we had our home checked. Luckily, there wasn't any toxic, levels of anything. There were trace levels, but not toxic levels.
Okay.
So everything seemed safe at that
maybe
point.
it was from somewhere else.
So it could have just been, is that like something easily like picked up? Like, do you have to be in an environment for long periods of time to like actually, induce or inhale those things? Or could it be like you went to a restaurant, you were there for an hour,
I think probably most of the time it's something a little longer than just like a
Okay.
one exposure.
Yeah.
But there's a lot we don't know too.
Yeah,
So
yeah. I mean, it's glad that there's
sometime in the
treatment.
past he's had that exposure.
Okay.
So our job now is to get that out.
And so this is like a combination of like different vitamins,
Yeah, it's a lot
maybe
of
things that you drink.
different herbs and
Okay.
supplements that we're using.
Does
We're
it
not
taste okay?
needing any prescriptions right now.
Yeah. Do you like taking all these little vitamins and drinks?
Yeah.
It's okay.
There's a lot. It's a big process.
It's a
Yeah.
lot. He's not always happy with
And
it,
then
not
I know-
every morning.
I did like an environmental test personally, and there was pesticides had come up, which I hear is very common from like
It is.
the yard work, you're tracking and things on your shoes, but and so I had done like a handful of supplements for about 6 weeks. And then another thing was like this black powder that I would have to.
Yeah, that's a binder.
Okay.
It's gonna
Whew.
grab all those toxins.
Yeah,
and get
so
it
I
out.
would like do a little teaspoon of that with the 8 ounces of water and just plug my nose and I don't know, does he have to do that?
It's actually in pill form, so
Okay.
it makes it easier. He just swallows it. Although there's some liquids and a gel that.
So they call that a
Easy.
binder and you,
Yeah,
because
because
everything
it
like,
binds to toxins.
Okay.
Yep. And then the next step is going to be to really work on getting the heavy metals out, and we'll just get to that when we're finished with some of these other processes.
oh, great. I'm so glad to hear that. I mean, where can people like get in touch with you guys as far as if they have concerns for their children? I mean, do you have a Instagram and website?
Yeah, I know our clinic's on Facebook. We just changed our name, so it
Okay.
was the Center for Health and Healing. Our new name is Kale Functional Medicine. So
Like
either way-
KALE?
Yep. like
Kale
the
Functional
vegetable.
Medicine. Okay.
Okay,
And you're
I'll be
Houston
done.
Neuroscience Brain Center.
That's correct, and it's just hnbraincenter.com is the website.
Okay.
And then we do have an HN Brain Center Instagram as well.
Okay.
And speaking of the, we just did a special yesterday on insecticides and pesticides. I do discussions with Dr. Ron.
Really?
And there's, we have found actually one case where a child had abnormal toxic levels of Roundup in their brain, and it's because the pores of the feet are so porous that you spray Roundup in your backyard and the kids walk on it, and some kids like Jacob can't chelate it out naturally, and it builds up to toxic levels. And you know, these kids would not be treated if we hadn't caught it correctly and diagnosed it correctly.
Isn't that wild? So it goes like literally from there, and it's getting in their bloodstream, and like, and it just, the brain just kind of brings it up. Is it?
Well, the
you know, 'cause
brain's,
you would,
the toxins are stored in fat. Well, your brain is mostly fat.
okay.
And so,
So it commonly,
it sucks it up to the brain. It's just amazing. It passes the blood-brain barrier and all sorts of issues. So when you see these abnormal behaviors start to occur, don't just think they're automatically something to do with puberty. It may be that we've got something else going on, and there's a lot out there.
So we do have to wrap up, but you know, just from a long-term perspective, like in children that you guys have treated, like, you know, what would you tell Angela, like, this is the future of like of what Jacob's condition is going to translate to? With, you know, it sounds like this is very curable and you're doing just that, but what have you seen like long term after having kind of cleaned out their systems?
Well, behavioral improvement,
Continual.
mental clarity, making better choices, better grades, just better lives. We want that joy and that flourishing for kids.
Yeah, to come back. And Angela, is there any advice that you would give other parents?
Yes, I mean, you know, we were so blessed to be connected with Dr. Ron years ago, and you know, even in a mother trying to make the decision of, you know, do I medicate my child, do I not medicate my child? Prior to going to a med doctor or behavioral doctor, we went to Dr. Ron, and there's so much research that has been done on the brain and with ADHD and with autism, and knowing which medications to use dependent upon, you know, what they're seeing with the brain. It really can take a lot of the guesswork out of it, and so you know, that's another whole experience that we've had with brain mapping and working with Dr. Ron to kind of diagnose at that organic level. And so, you know, at functional medicine as well, I mean, going through the process, no one has ever looked at Jacob enough to order the extensive set of labs that we did, and to have somebody who has an interest to really get to the bottom of it and give this picture of all of this stuff. You hear about all of these diets and, you know, leaky gut and gut-brain health and all of this stuff, but to know for sure that this is something that has been plaguing him, and the way he processes food, and the way he, you know, some of this was creating this inflammatory condition in him. And to know the direction to take to heal it, I mean, that's indispensable.
Yeah, no, I mean, exactly. Well, awesome. Well, thank you, and thank you, Jacob, for joining us. I know you had a great time with your mic. And thank all of you. I really do appreciate y'all coming out to share your stories.
Yeah,
so.
thank you.
And thank you all for tuning in to another episode of Hatching for Health. We'll see you right back here next week.